wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. Well, folks, guess what season we're in? It's tree pollen season. And you probably walked out and seen your car covered with yellow pollen. That's all tree pollen. And tree pollen, in a certain percent of individuals in the country, somewhere between 30 and 40% of the people have allergic disorders, and they react to the pollens that are in the air. This is tree pollen season, and as you can see on this car, it's covered with yellow pollen, and that's floating in the air. You don't see it in the air, but you're inhaling it into your system, and if you have an allergic disorder, those pollens are creating a reaction. Your body's making antibodies, and they're binding to mast cells within your respiratory tract from the tip of your toes down into your lungs. And those mast cells, when those antibodies attach to them, will rupture, and they'll spill a chemical called histamine. And most of you that have allergies have taken or do take antihistamines to block the allergy reaction and to block the histamine. The histamine causes the tissue to become inflamed and then to begin to drain. So you get chronic rhinitis, the draining of your nose, or you get chronic sinus infections. You get chest congestion. And in some individuals, you develop asthma, which is an allergic disorder. This chronic allergy reaction can affect your adrenal glands. Your adrenal glands sit on top of your kidneys, and they make a natural occurring hormone called cortisol. Cortisol is a natural occurring steroid. I know you've heard of prednisone or cortisone shots. Your body makes cortisol, and that cortisol helps relieve the inflammation. For individuals with chronic allergies and who have additional stress, whether it's chronic pain, whether it's chronic emotional stress, all this affects the adrenal glands, and they produce cortisol. And over time, the adrenal glands can become fatigued. So when the adrenal glands become fatigued, you get symptoms like exhaustion and brain fog, and you just don't feel well. You're sluggish, and you have chronic inflammation going on in your body, particularly in the respiratory tract. Also, allergies can cause skin disorders, eczema and other skin disorders. So allergies are a significant health problem that really adversely affect a person's ability to function normally in life. So what do? Most people go buy something over the counter, Claritin, Zyrtec, they buy Benadryl, maybe they buy some inhalers, trying to relieve the allergy symptoms. That's simply masking the symptoms. Allergies can be treated. If you go to a conventional allergist, they'll do some skin testing, and they may put you on allergy injections. You got to go into the office once a week, get a shot, sit there for an hour, travel to get there. And over time, that's supposed to build up blocking antibodies that block the allergy reaction. At the Hotze Health and Wellness Center, we use low-dose immunotherapy. Most allergy injections you get at the routine conventional allergist will contain 20 to 40 different allergens. I trained as an ear, nose, and throat allergist and was the president of the Pan American Allergy Society back in the 1990s. And we used injections, and then we transitioned to sublingual drops, where instead of giving an injection once a week, we simply put the allergens in a dropper bottle, and you put them sublingually under your tongue on a daily basis, which help build up blocking antibodies. It's called immunotherapy. And it's kind of hard to imagine that you're going to take very small microscopic doses or micro doses of the very things that cause an allergy reaction. You're going to take those under your tongue or even injection form, and it will stimulate your body to build up blocking antibodies that will block the mast cells from rupturing and causing the release of histamine, which cause the allergy reactions. And so allergy immunotherapy has been shown to be effective, particularly ear, nose, and throat allergy treatment. And that's the method that we use. Over the last several years, we have been introduced to our patients low-dose immunotherapy that contains very low doses. I mean, 1 to 1,000, 1 to 10,000 of the very allergens and chemicals and foods that cause allergy reactions. It's not only the airborne allergens, like the weed pollens in the fall and the tree pollens in the spring and the grass pollens in late spring and early summer, mold year-round, animal danders, and dust mites in the bed. All these cause allergic disorders. But we use low-dose immunotherapy where we give somewhere on the order of 300 different allergens, airborne allergens, food allergens, and even some very low dose and chemical sensitivities, because a lot of people with allergies develop chemical sensitivities. They kind of be around certain fumes from various chemicals that are in the environment, toxic chemicals, and those cause them to develop the allergy reactions. All this puts a stress on the adrenal glands, and over time, the adrenal glands, particularly in individuals that have bad allergies, and on top of it may have chronic pain, may have stress in their life, the adrenal glands are, think of it like a muscle. You can lift weights for a period of time, and after a while, when you start getting pain in your muscle and lactic acid gets produced, and you have to stop because they become fatigued. Your muscles can become fatigued when you do weightlifting or even when you're jogging. So that's the same thing that can happen to the adrenal glands. They become fatigued and they produce lower levels of cortisol. I also found in many individuals, particularly women, as they march through their menstrual life, as their female hormones become imbalanced, they would come to me and say, I never had allergies before I had my first child or my second child or third child, and now I've just got allergies running rampant. Well, I knew then that from our stories from our guests at our center, I knew that allergies were in some way related to hormonal imbalances. And when we began to correct hormonal imbalances by balancing out the female hormones as women march through their menstrual life, that helped relieve their allergies. So in our treatment of allergies, not only do we use low-dose immunotherapy, which is taken once every 7 weeks, a simple squirt of these allergens under the tongue every 7 weeks helps relieve, in about 80% of our guests, it helps relieve their allergy symptoms, and some of them absolutely dramatically, and this includes asthma. We also, in many of our patients that have chronic allergies, will use low-dose cortisol. Your body adrenal gland in the normal individual makes about 20 milligrams of cortisol a day. When you take an oral cortisol capsule, about half of it is absorbed. So in order to get, if you wanted to replace all the cortisol that your adrenal glands would make, you'd have to take 40 milligrams. Well, we'll start individuals on very low dose of cortisol, maybe 2.5 milligrams or 5 milligrams. If they're having a bad attack, maybe we'll give them more. If they're having asthma, we'll start with very high doses and then slowly reduce those doses like people do when they take prednisone. They take high doses and then slowly reduce them. Prednisone, though, is not a natural occurring steroid. That's why we use natural cortisol. And we use that, and we have seen dramatic improvements of individuals who have chronic allergies and asthma by using very low doses of cortisol combined with low-dose immunotherapy, and in women, balancing out their female hormones. So we'll use natural progesterone, we use cortisol, we use low-dose immunotherapy. We also use pregnenolone, which is the building block of all your natural hormones in the adrenal gland, both male hormone and female hormone. And this helps relieve the stress on the adrenal glands and enables the body to heal the inflammation and control the allergies so you don't have these severe symptoms in the spring and in the fall or year-round if you have mold allergy. That's why at the Hotze Health and Wellness Center, we have focused on natural bioidentical hormone replacement, whether it's low-dose treatment with cortisol or treatment of the female hormones. And in males, as they mature and their testosterone levels decline, we also use testosterone in males. All this helps relieve the pressure on the adrenal glands, and it helps relieve the inflammation that is caused by the production of histamine by the mast cells. And then the low-dose immunotherapy literally blocks the allergic reaction, and this has proved to be very, very beneficial. We started as an allergy practice back in 1989 and continue to do allergy treatment. So right now, if you're experiencing allergic disorders, then I would recommend you give us a call here at the Hotze Health and Wellness Center. We'll be glad to evaluate you and see if we can get you on a path of health and wellness naturally. So you've got energy, vitality, and you've got enthusiasm for life. Thanks for joining us today. I'm Dr. Steve Hotze.
At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom-made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physicians Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.